The talk on who pays for your health care is heating up. And right now, if you're over 65, the government pays most of your doctor bills through Medicare. Well, this group, take a look, marched in Seattle. They say everybody deserves that option, 65 or less. And doctors are calling, some, for the abolishment of an insurance industry that profits from concern over illness when people pay their premiums. Others aren't so sure, though. They say universal health care, backed up by the feds, will limit your options and could cost lives. Amy Menefee is one of those people. She's policy advisor for the Patients United Now project. Amy, thanks for being with us. Good morning to you.
Hey, thanks for having me.
Tell me, first of all, whether or not our health system is so broken that a single-payer system is the only option.
Certainly not. I mean, everyone agrees that we have a healthcare crisis. People are struggling with costs, and that's why we've started Patients United Now, because patients are the ones who are the biggest constituency in this debate, and they're not really being heard. You know, if we go with single payer, the question is this best for patients? And the answer from everything that we've seen worldwide is a resounding no.
Medicare is an example of a government-backed single-payer system.
Definitely.
Canada has one that's very similar, too. Are you aware of specific examples where a single-payer system has actually hurt a patient?
Definitely. We actually have a TV ad right now with a wonderful woman named Shona Holmes, and she's a Canadian citizen who had a brain tumor, and she needed immediate surgery. Canada told her, I'm sorry, you have to wait 6 months to even find out exactly what type of surgery you need. And she was aware that, you know, I'm going blind. Her vision was being affected. And she said, I can't wait this long. She came to the United States, got the treatment she needed, and it saved her life. She would have died if she had had to stay in Canada and wait in this long line for treatment. And, you know, to those who are saying that we need Medicare for all, I don't think they've thought through the doctor problem we have in this country. We have a doctor shortage that is only growing worse, and doctors are actually pulling out of Medicare. The New York Times has done some excellent reporting on this. Medicare is not even covering doctors' costs in so many instances. They're not paying for the care that the doctors are providing. We can't put everyone on Medicare if we have fewer and fewer doctors who are even taking the payments.
So when we see these rallies that are in favor of a system that the president has said he would like to see put in place so that everybody gets health care, what do you want the people to know? Because if you Google single-payer system, it sounds like a panacea. It's got everything. You get the doctor you want, you get to go when you want. What is it you want people to know?
Well, first of all, we'd have to tell people that's not true. It's simply not true. And right now, President Obama is calling for people to support health care reform, but he's not telling us what that means. You know, he's asking people to start these house parties again, which they did during the campaign and shortly thereafter, and he's saying you just need to support health care reform. He's not even telling people what that means, whether it's going to mean higher taxes, whether it's going to mean longer lines, waiting times, whether it's going to mean your politicians are going to be getting between you and your doctor, and that you might not be able to get the care that you need. These are some of the threats that we really face if we go with a more centralized, federally federal oversight of health care.
Which would put a lot of the private industry, including insurance companies, potentially out of business. I could see a lot of jobs lost there, too.
That's right. And I mean, we're not arguing for any specific, health insurance company. So many people have issues with that. But what we want to see is patients really getting involved in this debate. That's why we started Patients United Now. We're getting stories right now from all over the country, people who are just recounting amazing tales of health care that they needed, that they got in the United States in a timely manner when they needed it.
Right, from places that had universal. Let me see if I can just get in one more question, Amy, because I'm all about we report, you decide. But we may learn this week, Senator Kennedy may actually outline a health care plan, and we may learn more about it. But I'm just curious, is it possible that illegal aliens will benefit from a single-payer system and that some Americans will not get the health care they need because the system gets flooded with illegals?
I think those are both realistic possibilities. I mean, right now we are paying for illegal immigrants' care because they are able to go into the emergency room, which unfortunately our emergency rooms have a lot of people going there who really just need to go to a primary care doctor. And we need to remedy that problem. The remedy for that problem is definitely not single payer, because then the rest of us have no other options for our care except for the government.
Amy, let me mention Patients United Project is your organization. There's lots of information about this at foxnews.com and elsewhere, and I would encourage everybody, if you care about your health, to certainly learn more about the topic so you can decide. Thank you.
Thank you so much.
Eric?
Well, Jamie, a domestic dispute turns deadly. A Washington man threatens to blow up his neighborhood.